Okay, good afternoon, everyone. I'd like to start by asking you all a question. How are you feeling today? Okay, some common answers to this, heard a couple, are good, fine, okay, could be better, but it's all right. A lot of the times we say these things when we have an opportunity to elaborate on them, or perhaps when we're not feeling our greatest, but we don't want to burden the people around us with our feelings. And I want you to take a second and ask that question and answer honestly with yourself. Elaborate. Why do you feel good? Why do you feel bad? Did you answer good, but your actual feelings go deeper than that? Often we are coached to make other people comfortable, make other people feel safe. In fact, that has been the mantra of this entire pandemic. How do we keep others safe? Wear your mask, get vaccinated, if not for yourself, then for somebody else. And I've heard this many, many times, over and over again, and of course it's important. It's incredibly important to understand that our actions, especially during a pandemic, absolutely affect other people. However, I want to flip the script today, and I want to make you understand why it's important to keep ourselves safe. How do we keep ourselves healthy? Good afternoon, I'm Christiana, and I'm going to be talking about the bilateral implications of COVID-19 and mental health. So you may be asking, what does that even mean? Essentially, what the bilateral implications mean is how COVID-19 impacts mental health, and on the flip side, how does mental health impact your chances of getting COVID-19 and how severe these situations will be? Well, to start off with, I think many of us have realized that the pandemic has completely shifted how we experience life, and measures such as isolation and closing down jobs, etc., have impacted many, including job loss, economic failure, not being able to see other people, social isolation, isolation from your friends, family members even dying from COVID-19. And all of this has had a profound effect, I'm sure, on many of you, but also on society as a whole. In January to June 2019, the US Census Bureau found that 1 in 10 adults reported that they had depression or anxiety. This number was up 300% by the next year to 4 in 10 adults. These numbers are completely staggering and indicative of something that is going to last much longer than the actual pandemic. In addition, a KFF study found that out of young adults 18 to 24 years old, 56% of them reported having depression or anxiety. In addition, these numbers were even higher in parents with children, with mothers reporting at 49% and fathers reporting at 40%. It impacted community colors even more, with Hispanic and Black adults reporting higher levels of depression and anxiety than white adults, and Black parents reporting at a higher level for their children's well-being and the impact on education. All of this to say is that our mental health as a society hasn't been great these past 2 years. And as I've said, that has been a large result of restrictions put in place because of COVID-19. But I want to talk about the effects of COVID-19 in particular for the people who get COVID-19. Compared to 6 other health conditions, COVID-19 was at a much higher rate for people who were diagnosed in the 14 to 90 days after they were diagnosed for being diagnosed with a comorbid psychiatric condition at 18.1%. 18.1% of people diagnosed with COVID-19 in the next 14 to 90 days would also be diagnosed with a psychiatric disorder. Of that 18.1%, 5.8% were brand new diagnoses. Let that sink in. These included not only depression, but anxiety, post-traumatic stress disorder, irrationality, anger, and many other effects included in a wide variety that I could not possibly list here at the time. And these effects were also found in people who were socially isolated by themselves. Now that you know how that COVID-19 can impact people when you get the disease, I would like to talk about how having pre-existing mental health conditions can affect your chances of getting the disease and the severity of the disease once you get it. By the end of 2020, psychiatrists were finding that people with mental health conditions were at a much greater risk for COVID-19, And a New York University neuropsychiatrist wanted to determine why, which diseases, and to what extent. Her name was Caitlin Namani, and she and a group of colleagues studied over 7,000 patients in New York City and found that in people with schizophrenia diagnosis, they were at a 2.5 times more risk than the average person of dying from COVID-19 and contracting the disease. This was also found in people with depression and bipolar disorder, which was 1.5 to 2 times more likely. That's a scary number, considering I just told you we're up 300% in depression symptoms. So why is this? Why is there a connection? Well, something that scientists have postulated is that this could potentially be due to immunal dysregulation due to chronic inflammation. Essentially what inflammation is, it's a flood of fluids that are sent through your system in order to deal with an infection, which is why often infected areas are swollen. And this is great for dealing with SARS-CoV-2 and the viruses that cause coronavirus to a limited extent. If you have chronic inflammation, as is present in some people with depression, then this can cause immunal dysregulation, which can increase the severity of the symptoms and make you more susceptible to getting COVID-19. Essentially, what I'm trying to say is your mental health is critically important, not only for your brain and for your general well-being, but in order to take care of your physical health. Often when the discussion is centered around physical health and mental health, it's discussed as if physical health is somehow much more important. It's right there. If you break your arm, you go to the doctor's office and you get it fixed. If you're experiencing symptoms of depression, many people write it off as, I had a bad day, I had a bad week, had a bad month, a bad couple of years, especially during the pandemic. I'll get over it once I finish this work assignment, once I finish this homework assignment, once I get this person out of my life, once I move on, once I move. However, it's not that simple. And while you are ignoring these issues, it is potentially affecting every single part of your body. We as a society need to stop looking at mental health as something that is isolated to your brain, but rather as a full system problem. And I hope to impart on you today that because it not only affects your mental health and you needed that little push to understand why your mental health was so important, I hope I provided it to you today. It is not something that can be brushed aside. It is not something that can be ignored in favor of pushing through or getting something done or efficiency, expediency, etc. It is something that is critically, critically important. And I know many of you out there may say, well, I don't have time for a therapist. I don't have money for a therapist. I have no way to get there. There are many telehealth options, and beyond this, you also all have a system of family and friends who are there to support you, who are willing to support you. You are not a burden to them. And it is important that you understand this so you can share how you are struggling with them so that you can begin a journey of fixing not only your mental health, but also your physical health and feeling better overall. So I'll ask you again today, how are you feeling? What resources are available to you? And again, how can you keep yourself safe? And how can you keep yourself healthy? Thank you.